All right, today we're gonna talk about runner's knee. So, first things first, if you are having knee pain, you need to go see a doctor. But knowing that many of you are runners like myself, you will not. So, I am hoping that this will help you out a little bit. Remember that these exercises are both preventative, keyword there, and to help you recover. So, if you are having any kind of knee pain, again, doctor first. Now, let's get to it. What is runner's knee? Unfortunately, it's a broad spectrum that doctors use to cover all kinds of things. But in general, it's going to be pain below your knee, the outside, or the back. That sounds like everything, right? But it's worse when you are running downhill or going downstairs. So those are key indicators that that's probably what you're dealing with. And runner's knee specifically, to help you out a little bit, would be, think of your femur as these two little bumps. Your kneecap should slide back and forth easily between the two. However, when you start to get tightness in your IT band or in your inner thigh, because all you do is run in a forward motion, things stop sliding the way they're supposed to. So we're gonna look at a couple of different exercises that again are going to help really strengthen those quads, those hips, those glutes, all the areas that we tend to be weak in. Exercise number 1 is going to be a marching hip bridge. So you are on your back, feet on the ground, lift your pelvis up, and now you're going to do a very slight march. So the key here is you are going to have to engage everything, your core, your glutes. They've got to be super tight because you do not want your hips to move at all. So your hips should stay completely level as you are doing this march. Now, you could do it for up to a minute, that's kind of the goal, but the second you start to feel your hips moving, drop down, take a break before you do it again. The second move we're going to do is the good old-fashioned clamshell. Laying on your side, knees stacked, feet together, you are going to start to raise that top leg, keeping your feet together. 10 to 20 of these might be enough to make you start to feel fatigued if you haven't been working this muscle. If not, it's time to add in just a little resistance with a super cheap band. Again, key component here, you need to really have that transverse abdominal tight. You're getting your whole core engaged here. Next move is a leg extension. So if you have a small ball, or even you can see I'm using a yoga block, you're gonna be back on your back, put that between your knees, and you are squeezing for dear life as you then raise one leg. That squeeze needs to stay on the whole time. So raise it, hold for a second, back down, repeat on the other side. The final move is best done in front of a full-length mirror. So you're gonna be standing on one leg, slightly bend the knee, and then you may start to notice that that knee starts to shift inward. Now I'm gonna exaggerate it a little bit in the video here, but what you wanna do is keep that knee out, almost aligned with your pinky toe, and hold that position. You're really working those quads and those hips again, and you're kind of helping to retrain some muscle memory so that when you land in that position while running, your knee doesn't fall inward. Final tip, as always, spend some time doing the foam roller, spend some time stretching, help that IT band relax a little bit. And of course, if you have questions, if there's anything else you want to know about a runner's knee, IT band, or other injuries, hit me up in the links below. I'm always ready to talk.
Hey guys, Amanda here. Thanks for sticking with me all the way to the end. I hope you'll check out some of the other things going on around Run to the Finish. You've got links below to all kinds of exciting stuff, and of course, hit subscribe so you never miss another video.